Hi, everybody. It's Jessica DeMassa with WTF Health. What's the future of health? We are talking to the who's who of health innovation and technology. And today we have special guests all the way from Europe, from Berlin to be exact. We have the team from Bayer's G4A program. We have Sophie Park. She is their chief strategist. And a new face, Dominick Kennerson. He is the new global head of digital health and G4A. So welcome, you guys. It's a pleasure to have you with me.
Thanks, Jess.
Thanks for having us.
So you are in Berlin, so we'll get a quick update on what's going on in digital health in Germany. And I mean, you guys really have a worldwide perspective. And the reason we're going to start out there is because I think whatever trends you're spotting are going to kind of hit a culmination point in an event that you guys are hosting on November 18th, coming up here right quick. It is the Agents of Change event, and I want to hear more about that as well. But before we dive in, give us like a just quick state of play. So if I'll start with you. So what's going on over there in Europe? I mean, we checked in at the beginning of the pandemic. We were seeing a rise in telehealth utilization, lots of digital health, remote monitoring was starting to get, find its legs there. But like, what are you seeing? I mean, from your vantage point in Berlin, and also with some of the startups you're working with that are global.
Right. Yeah, I'll kick it off, and Sophie, she always edits me anyway, so she can jump in as she likes. I mean, just so much of what we're seeing, I mean, if we start at the overall market, there's just so much market validation right now. And that's something we didn't have 10, 15 years ago, or even last year. And part of, what's really helping that along is the regulatory space. I think for Germany, now that we have the digital therapeutic reimbursement, there are only a handful of companies that are actually in this model. But what we see is that from a German and a Berlin perspective, these kinds of, this framework, everyone around the world is looking at this. We've talked to a number of consultants who have Germany right behind the US in terms of digital health kind of infrastructure and strategy. And to me, that's a really, really kind of a new trend and something we haven't seen before, I think, up until now.
Right. And just from the perspective from the companies that are in our portfolio in itself, right? I mean, we have companies all across the world, but what we really realized is that when this pandemic hit, aside from the fact that, all of our companies are within that healthcare space and it was considered, right, an essential service in this time, but they were really able to pivot in changing their business models and adapting to the needs of people and the infrastructure around them, which is really amazing to see as well. And I think that was a really important factor that we saw because it really plays into the whole fact that Dom just said, right? We're seeing this more mature market that's finally ready to scale. And we also see that through investments, right? I mean, the largest investments and IPOs that we've seen so far this year come from healthcare, less smaller deals, but much larger deals. And I think that's a hugely promising sign for digital health. It gets us really excited.
It is. Oh my God, it's the same here. Totally get excited. And I love how you guys have summarized this. It's like market validation, and not only from, utilization, but also from, the investment side of things. And it's like, you guys are so uniquely positioned, I think, in your organization, one of the biggest life sciences companies in the world, but you're also the team that works with the innovators, the entrepreneurs, the startups. And so you have this really cool vantage point, I think, of looking at, how these, Sophie, what you said about, some of these companies being able to pivot so quickly. That's like such a unique thing to hear from a giant pharma company, right? Like, look at their ability to pivot. That's why you guys work with them. So that's really cool. What's been changing with G4A? Because I mean, speaking of pivoting, I know you guys have undergone a little bit of a transition yourselves. I think there's been a little bit of, I guess, shift in the way that you guys have been, looking out at some of these entrepreneurs and maybe doing a little bit more than just focusing on seed and early stage, which I think you guys were best known for a couple of years ago, but that's evolved along with the digital health market too, right? So say a little bit more about that. I'm curious about how you guys have evolved as a team.
Yeah, so kind of around seed and early stage, I mean, that's still a core part of what we do. So if anyone goes to our website, you will see our growth company strategy. You will see advanced companies as well. So we kind of have a net where we can capture both. Where G4A sits right now, we're part of a group inside of Bayer Pharma called Integrated Care. And this group is a part of a larger group called Digital and Commercial Innovation. So digital is, kind of at the top of the agenda for Bayer. And we are really on the ground running and capturing, all of these early companies and advanced companies to essentially position them for the future, and really that future is also around Bayer business models.
And really what changed last year from this year is that, we were originally offering these partnerships, some pilots and projects, but we are now looking for, larger investments. We're looking for, co-investments. We're looking for joint ventures. We're looking to build together with some of these companies that we do find in digital health, which is very exciting.
Right. I feel like we've seen that, and even with OneDrop, this year announcing the additional investment in them and the expansion of your partnership with them. I feel like that was one of those moments where it's like, oh, okay, it seemed like the strategy had moved forward, which I think is exciting to see. I'm curious to hear what you guys think is like, as far as like the way life sciences companies like yours or pharma companies are approaching digital health. Do you think that has changed as a result of the pandemic at this point? Or do you think it's the same? Like, is it still like, I feel like back in good old 2019 when things were cool, it was the, beyond the pill. Like, let's figure out how to take what we've already got and wrap digital around it. Do you think it's still that? Or do you think that maybe the perspective has been expanded where it's like, oh my God, digital might be its own category now. And we need to kind of get more, robust or get stronger and kind of building out, what this looks like, maybe owning DTX as opposed to, partnering or relying on DTX. Do you think that's changed at all? I'd be curious about your input.
Yeah, I see that from, I think, probably a little bit of a different view than most, and but a different view from Sophie. Because when I think about the biopharmaceutical industry, I think about the people making the decisions for these companies. And most of those people, and when you see this industry moves, it really kind of follows the agenda, around some of these trade organizations. Like in DC in the United States, you have Pharma, PHRMA. Digital has not been at the top of that agenda, and our company, I think, has been at the forefront in trying to get it there. Something that I think helps our companies kind of take more proactive steps is the fact that now, we actually have an FDA kind of digital center of excellence that has capacity. So now groups like that, and there are a few others around the world, can actually say, hey, we should maybe pay attention to this. I think at Bayer, we've been looking at it for several years. I actually think we're ahead of the curve. Mm-hmm. I think what people will see from us in the next 6 months to a year to 18 months, they're going to be very surprised at what a biopharmaceutical company is doing to really deliver a digital kind of a platform and solution that everyone can take a part in and join.
Do you want to dish on any of that stuff right now?
I just did.
No specifics.
Too much dish sharing.
I know, right?
But it's really what Dom said. And I think what we're trying to encapsulate is that we're looking at people, not as patients, but as people, as individuals. And how can we, not only with digital therapeutics, because, digital therapeutics, I was just Googling what I was talking about 2 years ago at Frontiers, 3 years ago, maybe at Frontiers Health, and I was talking about digital therapeutics, So I think finally pharma's at a place where they realize that it's an important thing, but I think what we as Bayer G4A realize is that digital health is just beyond digital therapeutics. It's about how do we support an individual human being from their entire life's scope and experiences of health. And I think that's what's truly different between what we're doing at Bayer G4A and other pharmaceutical companies.
This is a great time, I think, to mention the Agents of Change event. So on November 18th, because I'm looking at the agenda that you've curated there, and one of the standout sessions to me, it kind of speaks to what both of you are saying. You guys are looking at digital differently than any other pharma or life sciences company. And Dom, what you said about it being something that's, prioritized and elevated within the organization, the entire executive team for Bayer is on a panel together to talk about technology and pharma. This is like unprecedented, right? So like never before. So what are they going to be talking about exactly?
Very good question. They're going to be talking about what is in store for the future of pharma in their perspectives, in the roles that they each have individually, so interconnected within an organization. And this is also kind of going back to your question before, how I think Bayer G4A is so differentiated, because you have these individuals on one, the entirety of pharma sitting down, talking about how they're going to drive digital health initiatives forward. And I think that's truly something different than before.
Right.
Yeah, I mean, I think that's remarkable. I mean, like there was a point not so many years back where it was like, you would ask an executive team like digital this, and they'd be like, what? And now it's like all of them are together to talk about how it's impacting their business. I mean, that to me is like, it's a seminal moment, really.
Absolutely. Yeah. Yeah. I mean, so much of it, I mean, it's really like part of, I think, the challenge for digital health and for our companies is that we have these conversations in a bubble, and to kind of bring an executive level, board level conversation out to the general public, to investors, students, kind of everyone that's interested, completely unprecedented. And really the rest of the agenda, and I have to credit Sophie with a lot of it, I call her our mad genius. I mean, it's like, I look at it sometimes, I'm like, wow, like this is really remarkable. Everything from femtech to social determinants of health, patient-approved technology. I mean, it's really well crafted and tailored.
All right, Mad Genius, tell us a little bit more about that agenda. What else is on there that we should keep our eye on? And I should tell everybody too, I mean, to go and find out more about it, G4A.health, right? They can sign up there, it's free to watch this on the 18th. And then, yeah, I mean, so what else is on this agenda?
Well, the hint that I want to give you is if you look at that agenda is our roadmap. And that is the way I created it for Bayer G4A. And when you see each of these people speaking on such different topics, you'll hear them. If you listen carefully, you'll see that every single panel in some way is interconnected with each other. And this is what we really wanted to show, right? Everything from a high-level strategy on how do we get this done as a single company to going deep down into creating technology that's useful, not just for patients, but for people, right? That's people who are going to be using these technologies. And then to really lay that foundation we've all seen it with the pandemic this year, that there seriously needs to be something that changes within our healthcare systems. And this is what we wanted to show, to say that technology can be that intersection. It could be that bridge, right? To at least not make everything better, to make some things better. And that's what we're really closing off with. And we even have the German Federal Minister of Health keynoting our event. And on top of it, we have closing remarks from our Bayer CEO for Pharma.
Wow. That's a big deal. I mean, so much support, I think, too, for that agenda. I mean, and I love it, Sophie, that it's almost like its own little Easter egg in there for people to watch and figure out what Bayer wants to do next, like taking diligent notes.
Easter eggs. It's exactly what it is.
Yeah.
That's awesome. And so tell me then, so after this event, what happens next? So let's say people are looking at this, some of the startups that are out there are looking at this, and what do they do? How do they get involved? How do they make sure to be able to connect with you beyond just this? I mean, I think it's important for them to understand your agenda. If they're sitting there and they're like, oh, this is me, what do they do, Soph?
At the end of the event, we are, we highly, because G4A started as a grassroots movement. We really did, like even inside the company. And I think that's still so intrinsically ingrained in our DNA. And we would recommend people, not to only get in touch with us, but also get involved in their communities, right? We have meetups across 35 different countries, right, for STEM for Health that they can join, and it's, fully sponsored by G4A. We hold events throughout the year. And also something important that I don't want to forget to mention is at this event, we're also announcing our 2020 finalists and our partners for this year.
Okay, and so go back to that for a second, because I do want to give you an opportunity to talk a little bit more about this. So this is like, I remember the G4A signing days of old, having been there and done interviews with the startups who got their deals from Bayer. So is this the same thing then, or has it changed a little bit?
I would say yes and no. I mean,
good answer.
mean, really, because the way I learned digital, so much of it is just taking everything we do in the real world offline and putting it online. So the fact that this is a virtual health forum, Agents of Change, we will absolutely be introducing our startups. That's exactly the same. I think the startups that we have this year are really remarkable. When people see them, they're going to say, "Oh, how come we don't have those companies?" And that's kind of from both growth and advanced track kind of companies. So we have an amazing class. We were highly selective this year as well. I think you're going to see that. So we're not focused on quantity. We're definitely focused on quality. We even had to, unfortunately, some really high quality companies, knocked on our door, and we couldn't really work with them right now. So, there are a lot of opportunities. I think to your earlier point, Jess, we have no shortage of deal flow. People are knocking on our door every day, because they want to find out, kind of what the secret sauce is. And it's not just startup companies. These are other market participants and people that are in our ecosystem. And so that's something I think if they pay attention to Agents of Change, they'll see the roadmap. Maybe they'll find a few Easter eggs, but I don't think they'll be able to get the secret sauce.
Okay.
Sophie,
the mad genius with the recipe over there, isn't it? It's not spilling it. But I think it's interesting because I feel like you guys have really evolved. I mean, everything you said at the top of this interview about where the market for digital health and health technology has changed, especially in terms of its intersection with pharma. It feels like you guys are right. You're demonstrating that change in and of yourself and in the way that you've selected not only the startups that you're partnering with. Like, I love that. It's like not as many, but the quality is better. It's like, it feels like that's been the situation with these deals, all year long, around the world. It's been, bigger money into startups that are proven or that are scaling. So I mean, this all sounds like it lines up. I'm really excited to watch this event unfold and keep my eye on that Bayer roadmap and see where you guys are headed. Any last comments before I wrap this up?
No, we just really have to thank you, Jess.
Yeah.
Always great connecting with you.
Awesome. We're excited. We're excited to see Agents of Change. Again, the event is on November 18th. And then will there be a recording of it for those who may be catching this late, may have missed that November 18th? Okay.
There will be. They'll all be available online on our YouTube channel.
Okay, perfect. Awesome.
Yeah.
Well, check it out, you guys. It's free. Get an insight into where Bayer G4A is headed, where pharma is going globally with health tech and health innovation. And while you're on YouTube, you may as well check out the WTF Health YouTube channel for more interviews with people who are changing the future of health in real time. I'm Jessica DeMassa. Thanks so much to Sophie Park and Dominick Kennerson from Bayer G4A. We'll talk to you guys soon. Thanks for having us. Bye.